Taking all the sunshine, bottle up the rain. Go where the wind blows, let it show the way. Open all the windows, let in all the light. You can pull the stars down, paint the perfect sky. So go and write your song. The world will sing along. Life's what you make it. It's yours for the taking. You can test the water, might as well jump in. And we don't know where we'll end up, you might as well begin. Memories you're making, you frame inside your heart. The middle of a nowhere, so somewhere you can start. So go and write your song. The world will sing along. Oh, life's what you make it. Oh, it's yours for the taking. Go and write your own song. All the world will sing along. When you find your melody, we'll join in harmony. Oh, life's what you make it. Oh, life's what you make it. Taking all the sunshine, bottle up the rain. Go where the wind blows, let it show the way. Life's what you make it. Oh, life's what you make it. Oh, it's yours for the taking. Go and write your own song. All the world will sing along. When you find your melody, we'll join in harmony. Oh, life's what you make it. Life's what you make it.
Good evening and welcome. My name is Bill Johnson and I'm the volunteer chair for the Royal University Hospital Foundation's Mission Possible Operation New OR campaign. We're raising funds to transform surgical care at the Royal University Hospital Foundation. I'm very honored to be your host for this event this evening. And as we gather here today, I acknowledge that we are on Treaty 6 lands and the homeland of the Métis. We pay our respects to everyone within these lands, and together we are all one people. Thank you for joining us today for the Royal University Hospital Foundation's Grand Rounds and our second virtual Grand Rounds. This is the 22nd time we've done one of these, and really there's a great tradition of Grand Rounds, and it's been a time and a long tradition where in a hospital setting, doctors, staff, and donors have the opportunity to visit and learn about a particular case or some aspect of medicine. Donor Grand Rounds is an opportunity for our foundation to show an exclusive access to you, our donors, as to what we've been doing in terms of showcasing our patient care, our education, our technology, and research here at the Royal University Hospital. It's our way of saying thank you to you for really, for being part of this journey we're on together, and to give you a sneak peek at behind the scenes of what's going on and what you're helping to make possible. Tonight you'll hear from a number of physicians that will speak to you about the importance of new, innovative equipment that will improve the experience for patients and, most importantly, improve the outcome for patients at RUH. Thanks to generous donors like you, $1.5 million has already been granted to purchase priority surgical equipment at RUH. This includes cutting-edge equipment such as a handheld probe called a SPY-FI, which has been purchased for surgery here at the University Hospital Its first use is going to be in the colorectal and gynecological areas, but it will be used in surgeries across RUH. We'll talk more about the SPY-5 when I sit down with Dr. Hopkins and Dr. Gill later tonight. You'll also hear from a grateful patient who will talk about what his experiences were like as a surgical patient at RUH. As you watch, please feel free to send us your comments, send us your thoughts, and any questions you have to info@ruhf.org. I'm sitting here next to Dr. John Shaw, clinical professor and division head of general surgery. You were actually the person who was there when we received the SPY-5, and I saw the pictures, and you looked like a kid on Christmas Day who was opening up a wonderful present. Can you tell me a little bit about sort of that moment and what that equipment is? This equipment has meant to the hospital.
Sure. Yeah, it was like Christmas. You're quite right. It's something that we had known about and was evolving in clinical practice, and we had been exposed to it. Didn't really ever think that we would have the opportunity of having it in our own ORs. So it was a long time in coming. We had started trying to get people interested a number of years ago, and we're very grateful that the foundation eventually did pick up on this. And so it was a long time in coming, and then when it arrived, it's very exciting because it's truly something that has multidisciplinary applications. I wanted it for a very selfish reason for the branch of surgery that I work in, but there's certainly very broad applications, so it's something that's going to be very well used and very vital.
In layman's terms, can you tell us what the SPY-5 does and how it's going to be used at RUH?
Sure. It's essentially a way of visualizing blood flow and in real time using a sort of looks like a scanner, a barcode scanner. What we do is you inject a contrast or something that the scanner will pick up intravenously, depending on what you're trying to do. And then after a certain period of time, scanning over that area in the abdomen, you can see different things. So depending who's using it and what they're using it for, it really gives us a very accurate map of the perfusion or the blood supply to tissue, and it delineates or makes the anatomy that we need to see for more intricate procedures more apparent.
Well, that's it's fascinating technology. It really is, and you've already had some good outcomes with this piece of equipment.
Oh yes, absolutely. And again, speaking on my own behalf, the area that we use it for, it's allowed us to do things that we weren't previously able to do, or would have been incredibly challenging and taken a lot longer. So yeah, it's been a great boon to us.
Mm-hmm. And as I understand it, we're one of the first hospitals to bring this equipment into practice.
That's correct. Outside the very large centers, we're one of the few places that actually has it, and the application being fairly broad is nice. And I know you're probably going to be chatting to other people about this, but certainly from cancer surgery in oncology, cancer surgery in the bowel, cancer surgery in the liver and the pancreas, this is all we're finding good use for it at present, and there are more and more things that are actually evolving as the technology evolves as well as to what we can do with it.
Mm-hmm. So when patients are having operations and different surgeries applied, how does the SPY-5 help to improve their outcomes?
So unfortunately, it's not something that the patient may necessarily see or perceive, but as a surgeon, it allows us to do a much more accurate and detailed assessment of the operative or the operation field, particularly in looking at lymph nodes in the surrounding area that would have potentially been missed on previous or without using the technology for specific indications. And also, I'm talking about general bowel surgery, making sure that the joins that we do between two pieces of bowel are well vascularized with very good blood supply. That increases or decreases the risk of having a leak or complication from that dramatically. So for that purpose, although the patients don't perceive it, I think it gives us a much more accurate surgical technique, and also potentially limits complications.
Yeah, and produces better outcomes at the end of the day, which is what we're. It's fascinating technology, and it really does speak to what this campaign is doing, which is bringing the latest equipment and technology and putting it in the hands of the people who need it, and we're just so lucky that that we have donors who are able to help provide you with that.
Yes, absolutely. We absolutely delighted, and certainly without donor support, there is no ways that this would have found its way onto our budgetary sort of provisions for the year, and it has been a true game changer for us, and we're very, very grateful to the donors for that.
Mm-hmm. Dr. Shaw, thank you very much for stopping by and telling us a little bit about SPY-FI, and we look forward to reading more about it in the future.
Thank you very much.
SPY-FI was originally put to use by gynecologic cancer surgeon Dr. Laura Hopkins. She was recruited to Saskatchewan in 2019 to lead the province in gynecologic oncology innovation. She's another example of the quality of surgeons and physicians we're attracting to our province. What you're going to see now is some rather exclusive footage. It's actually the first surgery that was performed by Dr. Hopkins using the SPY-FI technology. And if you're a little squeamish, I will warn you that this might be a touch graphic.
Here is your first look at use of the SPY-FI handheld probe in surgery. And here we are in June of this year. We're operating on a patient with cervical cancer, and she's about to be checked for eligibility to enter into the first clinical trial ever in gynae-oncology in this province. And so we've already injected some contrast into the tumor, and there's been enough time for the dye to be absorbed into the lymphatic channels. In her case, we've had just enough time to allow that transit to occur, and we're about to apply. You can see the handheld probe in the right hand. Looks like a grocery store scanner. That's the SPY-FI device, and we're going to turn that on so that it's releasing infrared light from the end, and that will cause the dye to fluoresce green and outline the lymphatic drainage from where the cancer is out to the pelvic sidewall. And you see my colleague there, Dr. Brown Broderick, is pointing at the some of the channels that she can see, and it's not quite a good enough picture for you to see the lymphatic channels, but you can see those 3 dots on the pelvic sidewall, and those are lymph nodes that are starting to fluoresce, and we're trying to identify the first draining lymph node, and there it is there. You can see me putting it up on the stand in front of the nurse there, and then we're checking with the handheld probe now to make sure that it is fluorescing and confirming that it is the first draining lymph node, where if there's going to be cancer spread, it's going to be right here. So we've confirmed that. That's then going to go to the lab for confirmation. And in this case, this was a negative node, and we did the same procedure on the other side of the pelvis. And this woman was randomized. You can see we're very happy because she was randomized, again, the first clinical trial in gynae-oncology ever here in Saskatchewan. This was a really big day for all of us and for the team. So thank you so much for making this happen for us. Thanks so much.
So I'm honored and I'm thrilled to welcome you, Dr. Hopkins, and to the RUH Foundation Donor Grand Rounds. And I also want to welcome Dr. Dilip Gill. Dr. Gill is a specialist in general and colorectal surgery and a clinical assistant professor at the University of Saskatchewan. Hello and welcome to you both. And I'll start with you, Dr. Hopkins. Perhaps you use this piece of equipment, the SPY-FI, for the first time. Perhaps you can tell us what that was like and take us through that operation a little bit.
Sure. It was very exciting for lots of reasons. So the piece of equipment that we're talking about, the SPY-FI handheld probe, allowed us to enter as a site in gynae-oncology, enter into the first clinical trial for gynae-oncology patients that has ever happened in this province. So this was a major milestone for us to open clinical trials. It's something we've been planning for over 2 years now since the group assembled here, all newcomers to Saskatoon, recruited from other sites. And without the handheld probe, we would not have been able to accrue patients to this trial, which was a trial looking at cervix cancer. And the trial is designed to determine whether we can use the new technology, which is called sentinel node technology, to identify the first draining lymph node where cancer can spread to from the cervix, versus doing a full lymph node assessment for the patient, which is much more extensive surgery with lots of potential side effects and long-term morbidities associated with it. So it's a very exciting international clinical trial in surgery, and surgery trials are very rare in medicine because generally there aren't very many circumstances where patients and even surgeons are willing to randomize a patient during a procedure to one treatment or another. So this is an excellent trial. And we recruited our first patient, we enrolled her, and then the procedure is you inject the fluorescing dye into the tumor at the start of the procedure. And by the time you have the abdomen open and you're ready to use the handheld probe, the dye has had the chance to penetrate the tissues and to travel. And when you apply the infrared camera to the pelvis, it's like a fluorescent trail of breadcrumbs straight to where the cancer cells will have traveled. And hence the name, it's sort of spy, because it's not real espionage, of course, but it does allow us to see things that otherwise have been secret for us. And so we can identify the first draining lymph node on either side of the pelvis because it turns bright green for us. And you'll see that in the video clip, I think. And we remove it and it gets sent to the lab. And it's either got cancer cells in it or it doesn't. And then from that point, as long as there's no cancer seen on either side, the patient is randomized into the trial, either to a full lymphadenectomy or we're all finished right there. This trial has been going on internationally for a couple of years. Canada just came on, and with this brand new technology here in Saskatoon, I'm very proud to say that we are the #1 recruiting site in the country. Wow. I just got the statistics this week from the Canadian Clinical Trials Group, and Saskatoon is #1. So we're putting it to good use. When you put these technologies in the hands of your surgeons, we promise to use them to your fullest potential all the time. So it was a great day for us.
That is so exciting, and that's and as you say, it allows you to be so much more precise in your outcomes. And so Dr. Gill, and you've also had an opportunity to use this technology. Perhaps you can tell us how that has gone.
Yeah, thank you, Bill. Within our group, so I'm a colorectal surgeon here in Saskatoon. We've incorporated SPI-FI as well as the laparoscopic version into our everyday practice. It's become routine now. I could say that we use it probably at least 3 or 4 times a week. On pretty much every case that we do. The way we use it from a clinical aspect is that whenever we do a bowel resection for whatever purpose, and if that's cancer or inflammatory bowel disease or diverticulitis or things like that, the biggest principle is when we want to reconnect patients' intestines back together, the biggest worry we have is that connection not healing. And we know that the principles of healing, you need good blood supply. Your tissues need oxygen and so forth to heal and recover. And prior to having equipment like this, we used our eyes. You looked at the tissue, you said, yep, this looks pretty good, and you connected them together. With this equipment, it lets us see in real time after we've sort of done our resection. We inject the dye intravenously, and within seconds it travels throughout the bloodstream, And again, using the infrared technology, it'll light up tissues that have good blood supply. So it'll turn nice, bright green. And I can't tell you how many times we've looked at bowel and said, yep, this looks good, let's do the test, and then have to take and resect a little bit more. And what that means is we can pretty much guarantee that that connection will have good blood supply. And we know that if those connections don't heal, they don't create a good seal, and that can make a person what we call septic, and people can die from that. And so this is life changing. I've thought about, who does this benefit, and it benefits everybody, because colorectal cancer, the incidence of that in Canada is about 1 in 15. The incidence of inflammatory bowel disease is about 1 in 100. Half the population will have diverticular disease by the age of 50. So, if you or someone you know and care about will have to have a bowel resection at some point in your life, unfortunately, and technology like this really helps to make sure that you have a good outcome.
Something you said really struck me. You said that it's become routine and you rely on it 3 or 4 times a week now, and yet we didn't have this technology 6 months ago. Mm-hmm. That's striking, and it just kind of underscores how important it is to have this type of equipment in place. And when you have equipment like this, it also, I think, leads to innovation. I think you two had a situation where along with one of your colleagues, you were privy to some innovation that occurred literally on the spot. Tell me about that.
It was innovative to me. It was everyday stuff for him. Yeah, I was. It was shortly after we started using the SpyFi device for the clinical trials, and I was doing an ovarian cancer debulking procedure, and ovarian cancer tends to expand in the pelvis, and it whatever it's touching, it's trying to make a tight connection to. And so the rectosigmoid colon is in the pelvis, right next to the ovary. And so in this particular case, I had worked for a while, literally, cutting sharply the tumor off the actual tube part of the bowel, but also its supporting tissue structures. And so it was bleeding and looking fairly beat up. I've seen that before. I've done that before. But this particular case, it was a little overly beat up looking to me, and I wasn't sure that the blood supply was necessarily still perfect and intact. And so I thought, well, I better just double check, and I'll get one of my colorectal colleagues, whoever's on call, to come and examine her bowel before I close, because maybe if it's not good, she may need a bowel resection, or we got to find that out here, not 4 days from now when she gets sick. So I asked who was on call, and 1 in 3 chance you're on call, I think. Dr. Gill was on duty, and he came in and did something that surprised me, but I guess it was a surprise for me because I'm just not used to having access to the SpyFi. Mm-hmm. Do you want to?
Yeah, so we essentially, the biggest question that we had in that case was, does this tissue have enough blood supply to survive? And so we use the SpyFi equipment in the same way that I use it every day to check, and the bowel lit up nice and green, so we knew that the blood was getting where it needed to go, and in that particular instance, the patient didn't need a bowel resection or anything. If we didn't have that equipment, just looking at that bowel, there's a good chance that would have had to have been resected, and potentially even have to have a colostomy and so forth, which can be quite devastating for patients, especially when it's unexpected.
Mm-hmm.
Wow, that just underscores the innovation that's taking place, and of course we're mentioning gynecology and the colorectal area, but the SpyFi has applications right across surgical outcomes and right across the hospital, doesn't it?
Yeah, I've come to find that out. I mean, we tend to, when you're a subspecialist surgeon, you tend to be, you're very focused on your scope. So I was so pleased that day when I was surprised and so happy at the same time when he asked for the ICG die. I just, of course, he's going to use that. That's fantastic. It's just everything working. It's great times.
Is this equipment that you had ever encountered before?
We had wanted it badly at the Ottawa Hospital, and we could not get approval to get that there. So we had worked at that for a long time. We used a earlier technology. It's still sort of a fluorescent idea, but much more difficult to work with and much less robust in your assurances of what you're seeing is truly accurate, I guess is a good word. So yeah, I was very excited to just have that request just supported so quickly by the foundation. And I was thinking about, how somebody asked me how it made me feel, and surgeons don't think about how they feel, I don't think, too much, do we?
No.
But I was thinking, like, we're not thinking about our feelings while we're operating, we're focused, but I was thinking about how I felt that day afterwards, and I think I felt the way I felt was that it was like the very people that were there to serve and help are reaching in and helping us. That's what it feels like when I pick up the SPY 5 probe. That's what it feels like.
And certainly taking a step back, you two both spend the better part of your working life inside of operating rooms, and you're privy to what the plans that we have to really reinvigorate and completely renovate the operating rooms we have here. Perhaps you can just talk a little bit about sort of what that will mean to your day-to-day professional life.
Well, I think when you look at the big picture, I think we have people. I think we have well-trained, world-class surgeons that are already here, and I think keeping up with the advances in technology allow us to sort of take it to the next level.
Mm-hmm.
So I think this is sort of one step forward for our province, and it's a giant step, to be honest.
Yeah, and is it fair to say that our people are ahead of the technology that we have to put in their hands right now?
I think that's fair to say. I think we use what we have to its maximum capability, and I think we do a great job. But I think every time you see and having bad outcomes and having complications and things like that are the unfortunate part of what we do, and anything that we can do to decrease the chance of that happening, we welcome. And utilizing advanced equipment to make that happen, I think that you can't put a price tag on that. That's for sure.
Indeed, yes. And well, hopefully we're able to put a whole lot more of that type of technology in your hands in the very near future. To both of you, thank you very much for taking a few minutes to sit down and talk with us and share a bit of what you're doing with our donors, because really they're the ones who make this technology possible.
Thanks, Bill. Thank you, donors.
Speaking of patients, I have a new guest sitting with me here. Corey Miller is Vice President of Provincial Programs at Saskatchewan Health Authority, and you're a busy man these days, to say the least. But you're also a grateful patient, and you're going to share with us your experience of being a surgical patient at RUH. And let's so tell me, first of all, how did you become a surgical patient?
Well, thanks, Bill, and thanks for inviting me to join the donor rounds today. It's such an important tool for the team. My story, like many people, is you never know when you're going to become a patient, right? So people in our community today often take for granted the tools and the infrastructure that we have in healthcare until the day you need it, or until the day your family needs it. And I've worked for 30 years in the healthcare system, and I never dreamt that it would be me needing to be on the other side of the table. And I've actually had 2 times I've required the support and expertise of the surgical team here at the Royal University Hospital in my life, and happy to share them with our donors, but also with the surgical team for the fact that I'm so grateful that they have the skills and tools and abilities. So the first time about 10 years ago, I was involved with a snowmobile incident where I required emergency surgery on my back, and the fact that we have so many highly skilled physicians in our infrastructure at the Royal University Hospital and the College of Medicine, Dr. Mike Kelly and Dr. Alan Wu, who are both locally trained physicians who went away and did fellowship training and came back to share their skills with our community. They both did surgery on my back, and I healed incredibly well considering the pain and the challenges that I was having. So I'm forever grateful for those two gentlemen, but also for the support that they had from our foundations, as well as from our province, to go away and get the training and bring it back. And little did I know I would need their support. So very grateful for them. And then 5 years ago, I had a tumor in my colon, and I never dreamt that I would need to have surgery for something like that ever, having worked in healthcare. But we had just recruited a new fellowship-trained colorectal surgeon named Dr. Gill, and I understand he's also part of today's Grand Rounds, and I'm forever grateful that we recruited Dr. Gill here. And when Dr. Gill came, he was promised some equipment that he trained on in his fellowship when he was abroad getting training, and to utilize the skills that he learned, he needed new equipment, which is often the case when we're recruiting specialized physicians. And so Dr. Gill, actually Arla came to me first, the Royal University Hospital Foundation, to talk about the equipment, and in the end they supported it. Little did I know, a few months later, I think I was the 9th patient that Dr.
Wow.
Gill utilized this new equipment on, and I'm grateful for Dr. Gill and the training that he went away for and came to Saskatchewan, and for the equipment that the foundation and the donors supported. Our donors, the donations they make allow us to recruit people like Dr. Gill to Saskatchewan. Without that surgical equipment, I likely would have required a colostomy bag. In addition to that, I'm a husband to my wife and my children. So
You make a very good point. That we all obviously are interested in having top quality medical care here, but when it's yourself that's on the other end of the knife, one becomes laser focused on the quality of it, and nobody, I don't think, dreams that it's going to be them that is going to be requiring these services. And,
absolutely.
And
I think our donors, our community often don't realize the technology and the equipment that is used on them while they're being cared for. Behind the scenes, especially in the operating room, our patients are sleeping in the operating room. They don't realize the high-tech equipment that's needed. And their donations allow us to purchase this new equipment, state-of-the-art, not just replacing equipment. Buying the next generation equipment allows us to recruit surgeons with new skills and abilities. And so that is tremendously important. But also sending away our physicians to get this fellowship training, sponsoring fellowships, having them go away for just training in general, and giving them the ability to go away. So that all of those different aspects allow us to recruit physicians, train physicians, even retain physicians. And many of the physicians that I know you have on your Grand Rounds tonight, they are highly skilled physicians, and without the support of the foundation, without our donors buying into the campaigns and offering their generous support, we can't retain these specialists who then help us train the next generation of physicians in our province, which is tremendous. So grateful to the foundation, grateful to our donors for their continued support of the surgical program. Dr. Gill, Dr. Hopkin, Dr. Shaw, Dr. Mendez are all highly skilled physicians that now help us train the next generation to have the same skills that they came here with. So grateful for our foundation and donors for all that they do for us, because without that support of the donors out in our community, we wouldn't be able to deliver the care that I personally have benefited from and get to see every day in my career. So I'm grateful for that.
you make a very strong point, that the focus of campaigns like this is often on the hardware and on the equipment that our doctors need and our physicians need. But really, the two go hand in glove, don't they? That, you can't have, if you have the best equipment and you don't have the people to operate it, you're no further ahead. And really, we've been fortunate that we're able to retain both. So Corey Miller, thank you very much for stopping by and for sharing your experiences. And I'm sure there are many people who are watching here tonight who have got similar experiences to share as well. Thank you, Bill.
And thank you, donors.
Well, I hope you're enjoying the donor grand round so far. I'm always fascinated when I have a chance to meet the medical professionals who are providing care for us and the people who are at the heart of our health care. I'm joined right now by Dr. Ivar Mendez. Dr. Mendez is the Fred H. Wigmore Professor of Medicine Professor of Surgery at the university, and also the provincial head of surgery for the Saskatchewan Health Authority. Dr. Mendez, we've been talking a lot about SPI-Fi and how innovative equipment like that is really at the heart of what we're trying to do with this campaign, and with surgery in general. Can you talk a little bit about how SPI-Fi is going to have an impact on medical care here at the hospital?
Sure. I think technology is extremely important for what we do. As surgeons, what we need the tools to try to provide the best surgical case possible and all the services to our patients. Over the past, I would say, decade, technology has advanced tremendously, and we're able to do things that we were not able to do in the past. And this specific piece of equipment, this SPI-Fi, is a system that allows the surgeon to look at the blood vessels of the tissue. And it's very important for reconstructive surgery, because when you do reconstructive surgery, you want to make sure that the tissue is viable and that the blood vessels are actually providing the nutrition to the tissue that you're operating. And this system will show you the viability of those blood vessels to maintain the tissue integrity. And it's a handheld device that the surgeons, especially general surgeons or plastic surgeons, will use to do this reconstructive surgery. But this is just one of the tools that we use. There's a number of tools that have really revolutionized the way we perform surgery. I'm a neurosurgeon, so I operate on the brain. And one of the areas that we've been working is in actually being able to navigate the brain in real time. It's like having a GPS in real time, that we're able to actually go to, for example, take a brain tumor of the brain in an area that may affect the speech of a person. So we're able to know in real time where we are with our surgical instruments. These computers will pick up the surgical instruments in our hands, and we're able to navigate and to be able to take tumors more safely and be able to do surgeries that were not able to be done in the past.
Yeah, and this technology, it's not a luxury anymore. This is a necessity, isn't it? And I think it certainly allows a smaller center like us in Saskatchewan to perform exactly the same kind of surgeries that are happening at any center in the world.
That's correct. Yeah, no, it is. Those are just the tools that we need to really to provide this care to our patients. And it's interesting because we have certain programs here that have transcended the borders of Saskatchewan. One of the programs is this neuromodulation program, where we can actually implant these special electrodes into the patient's brain to control tremors for Parkinson's disease or control a chronic pain. And we have patients that come from across the country to Saskatchewan, to Saskatoon, to be operated, patients that come from Toronto, Montreal, Calgary, Vancouver. So there are certain areas where we are really leading nationally. But we really want to make sure that everything that we do in Saskatchewan and in Saskatoon is a state of the art. We really want to provide the best care to our patients. We want to provide the state of the art surgical care. So people don't have to travel anywhere else in the country. They can stay here. They can receive the best care at home.
Yeah, and certainly, having that equipment also must help with your recruiting efforts as well, because the best doctors want to work with the best equipment.
That's correct. We are aiming really to attract the best minds here to Saskatchewan. And interestingly enough, over the past 5 years, we've been the fastest growing department of surgery in Canada. We have doubled the amount of surgeons that in Saskatchewan. In the past 5 years, we've hired over 150 new surgeons that have come throughout Saskatchewan, the majority of them here in Saskatoon. And you know, when you have young people that have trained in world centers across North America and Europe, these people need to have the appropriate tools. And we need to provide them state-of-the-art equipment so we can bring them here and we can provide the best care to our population.
Mm-hmm. And I think I read somewhere that not only do we have one of the fastest growing, we have one of the youngest surgical teams in the country as well.
It is true,
which bodes well for us in the future.
Yes.
And,
it has actually changed the culture on the Department of Surgery. You know, these young people with a lot of energy that have come from all over the country have changed the culture. We have a department that is exciting to be in. We're doing new things. We are expanding our surgical programs. Really, the philosophy is if we can do all types of surgeries and be able to provide that service at home, this is what we want to do. We want to create centers that not only can provide that service to Saskatchewans, but we also want to provide this regionally and nationally. We really are aiming to be the best.
Mm-hmm. Well, you perfectly encapsulated what the campaign that we're currently have underway right now is all about, which is making sure that we're putting the best tools into the right hands. And I thank you very much for your efforts in leading this charge and in reinvigorating our surgical team here at the University of Saskatchewan, at the Royal University Hospital.
Oh, thank you so much. I just want to say that without the help and the commitment and the generosity of our donors, it would be very hard to advance. As you know, we are in the midst of a crisis, the pandemic crisis. We have this huge backlog of surgical procedures that we need to do that. And we need the help of all the people of Saskatchewan to be able to do that. And I want to, again, help you, the volunteers that have been working in the campaign, the foundation that has put a lot of effort into it. But especially I want to thank all the donors that generously have contributed and will continue to contribute for us to provide the best care possible to our population. Thank you so much.
Well, thank you. And that's exactly what these donor grand rounds are all about. So, Dr. Mendez, thank you very much for taking a few minutes to talk with us.
Thank you.
These donor grand rounds are soon coming to a close, but I'd like to take a minute to thank Dr. Shaw, Drs. Gill and Hopkins, and Dr. Mendez for taking the time to sit down with me and give us a rare glimpse into their world. It's a world that we most likely don't want to find ourselves in as patients, but we all know that, as Corey Miller told us just a minute ago, that we or someone we know might end up needing this exact expertise. And now we know more than we did an hour ago about what our state of preparedness is and what we need to do next. Next, I'd like to take a little bit of time to tell you about the campaign that is being waged right now and what we're doing to make sure that we have the best care that we can possibly provide. As the volunteer chair of the Cabinet Committee for Mission Possible, let me tell you a little bit about this campaign. As you might know, Royal University Hospital's operating rooms are 43 years old. They were first built in 1978, and they are more than in need of some transformation. We're not doing the same surgeries we were in 1978, and yet we're trying our level best to do them in the same rooms right now, and that has to change. We did some minor upgrades to lights and floors in 2009, thanks to support we got from our donors in the Royal Care Campaign. But as you've seen here tonight, we have the expertise at RUH. What we need is the facilities that is reflective of that expertise. We need to give our surgeons the kind of operating theaters that they not only deserve, but that they desperately need right now. And that's what this campaign is really all about. It's making sure that the surgeons have got the facilities they need. In 2019, which was the last year before COVID, we did almost 900 surgeries that were 4 hours or longer. Those are long surgeries, and that tells you the complexity of the operations that are being done at Royal University Hospital. With the support of Mission Possible, Operation New OR, we will soon build Saskatchewan's first hybrid surgical suite. This suite will be twice the size and have 3 times the capacity of a standard operating room. And that's particularly important right now at a time when the COVID-19 pandemic has forced the delay of so many non-urgent surgeries. And it'll take us years to work through that backlog. This is good news. This is what we need. These hybrid surgical suites will allow multiple surgical procedures and multiple surgeons and specialists to operate on critically injured patients at the same time. And at a time when every second counts, having a hybrid OR will free up other operating rooms and help save lives. It'll help us deal with this backlog. I'm excited and I'm honored to be part of this campaign. I encourage you to contact the Royal University Hospital Foundation office and learn how you can join this mission. It's more than an important mission, it is a critical mission. Those aren't just words. We have serious work to do in the operating rooms at Royal University Hospital and across the province, across the country. And it's a very timely and important campaign we're undertaking right now. Thank you to everyone who helped make this virtual donor grand rounds an experience. I hope you enjoyed it. Hope you learned something. I certainly did. And lastly, thank you for joining us as donors and as friends of Royal University Hospital. We try to thank everyone who's involved in this hospital all the time, but we can't thank you enough for your generosity. Like us here, I know that you're passionate about healthcare and about making sure that Saskatchewan has the same level of healthcare and the same quality of care that we do anywhere in the province, in the country, in the world, really. And this campaign will help us get there. And I just so appreciate you taking a few moments out of your busy lives to join us. Your feedback is important to us. So, in both in terms of this donor grand rounds and in terms of planning future donor grand rounds. If there's something you enjoyed, please let us know. If you have questions, I guarantee you that the people at the foundation office would be thrilled to take your phone call and talk to you about any questions you have to ask. If you do have questions, you can email us at info@ruhf.org, or you can call the office at 655-1984. Thank you for joining us tonight for these donor grand rounds, and we'll see you soon.
Taking all the sunshine, bottle up the rain. Go where the wind blows, let it show the way. Open all the windows, let in all the light. You can pull the stars down, paint the perfect sky. So go and write your song. The world will sing along. Life's what you make it. It's yours for the taking. You can test the water, might as well jump in. And we don't know where we'll end up, you might as well begin. Memories you're making, you frame inside your heart. The middle of a nowhere's a somewhere you can start. So go and write your song. The world will sing along. Life's what you make it. Oh, it's yours for the taking. Go and write your own song. All the world will sing along. And when you find your melody, we'll join in harmony. Oh, life's what you make it. Oh, life's what you make it. Baking all the sunshine, bottle up the rain. Go where the wind blows, let it show the way. Life's what you make it. Oh, life's what you make it. Oh, it's your